My name is Mallory Jones, and I'm an RN to BSN student at the W, and today I'll be talking about antibiotic resistance and what we can do to help stop it. Okay, some SMART objectives are that the learner will be able to identify what bacteria are. Also, the learner will be able to identify what viruses are. And that the learner will be able to identify common illnesses where antibiotics are needed and where antibiotics are not needed. And that and the learner will also identify leading causes to antibiotic resistance. Okay. So what are the differences between bacteria and viruses? Bacteria are single-celled organisms that are all over the inside and outside of our bodies. Most bacteria are pretty much harmless, and they're called flora. We have bacteria all over us that live on the inside and the outside. We have bacteria in our gut that are good bacteria, and even then, sometimes when those bacteria get out of whack, they can also cause an infection. But not all bacteria are bad. Also, viruses need a host, and they are smaller than bacteria. And most viruses, they eventually die off. But antibiotics are not needed for the treatment of viral illnesses. Okay. Common illnesses where antibiotics are not needed are like the common cold, the influenza, also known as the flu, and bronchitis or chest colds in otherwise healthy adults or children. People want to know, why are antibiotics not needed? Well, viruses usually run their own course. You usually want to treat symptoms. Most symptoms of your common cold or even your flu is going to be cough, fever, runny nose, congestion, headaches, may have some fatigue, may even have a sore throat. Most medicines to treat the symptoms of the viruses can be bought over the counter. If you're somebody who has more medical issues going on and not otherwise just a healthy young adult or healthy child, you may need to consult your physician before taking any over-the-counter supplements or medicines, just in case they could interact with the medicines that you are already prescribed. Your local pharmacist, if you get your medicines filled somewhere, they pretty much have a list of everything that you're on, and you can always ask them questions about the drugs that you take and stuff that you're wanting to buy over the counter to treat the symptoms that are caused by the virus. Another way you can kind of differentiate between a viral illness and a bacterial illness, and this is not always the case, but usually if you're treating symptoms and you're treating them for 2 or 3 days and your symptoms aren't improving at all and they're starting to worsen or anything just changes, you might want to go ahead and go see your local physician or your family doctor and see what else may be going on, because you could also be infected with a bacteria and may need antibiotics. But more than likely, if it's viral, you will for sure not need antibiotics at all, and you can control your symptoms with over-the-counter medication. Every once in a while, if you're really needing extra treatment, you can always, usually the doctor may prescribe something like a steroid for to help with the chest congestion and maybe some difficulty breathing that you may be having if you do have a chest cold, or if you do have bronchitis, or even just the common cold. That may be needed. But other than that, no antibiotics will be needed to treat viral infections.
What?
Okay. Common illnesses where antibiotics are sometimes needed, but not always, are middle ear infections, sinus infections, and bronchitis or chest colds in immunocompromised patients. Just to kind of go into what immunocompromised means, it would be somebody whose immune system is weakened. Maybe your diabetic patient. Maybe your patient who has COPD. These things may need antibiotic treatment in them, and several other medical conditions, but that's when they're most often needed. Sometimes these infections can be caused by a bacteria or a virus. So you may take your child to the doctor, let's say they have an ear infection. Well, some doctors may say, well, let's wait a day or two and see if these symptoms start resolving on their own, because usually if that's the case, then the infection is viral. But if it does not start clearing up and the symptoms worsen and persist, it may be bacterial, and that's when antibiotics would be needed. Also, with a sinus infection, one way you can sometimes tell the difference between a viral infection and a bacterial infection is your bacterial infections. You may have some really thick green mucus and stuff that you're coughing up and kind of when you blow your nose. So that's really a telltale sign of being a bacterial infection, meaning you're probably going to need some antibiotics to get rid of that sinus infection. Only infections that are caused by bacteria are needed to treat, or antibiotics are needed for the treatment. A lot of your immunocompromised individuals, like your COPD patients or your diabetic patients, if your COPD patient gets a chest cold or they're starting to develop bronchitis because their lungs are already not fully functioning the way that they are supposed to, that chest cold or that bronchitis can end up turning into pneumonia, and therefore they may need antibiotics for the treatment of that pneumonia, or if it just keeps getting worse and worse and the symptoms are worse and they're not getting any better, that'll be needed. And then there are infections that are always caused by a bacteria and always need antibiotic treatment. And those are urinary tract infections, strep throat, and whooping cough. Antibiotics are needed to treat these diseases. If they are left untreated, they could result in death. One of the big things that we as healthcare providers see and that the community can help us with is when antibiotics are prescribed to treat any infection that the doctor's diagnosed you with. When they prescribe the antibiotics, it is very, very important to take the antibiotics as described. If you were prescribed 10 days and only taking 7 days worth of treatment, that could cause that bacteria to become resistant to the antibiotics that we're trying to cure that infection. If you stop taking them too soon, your infection may come back, or it'll leave you at more of a risk for developing an antibiotic-resistant disease in the future, because that is misusing antibiotics. You know, you might be prescribed Bactrim to treat a urinary tract infection, but you only take it for 2 days because your symptoms kind of went away. And then here you are a week or two later and all your symptoms are rearing back up, and it's because you did not take your prescribed course of antibiotics. So it's very common for people in the public that are not in the healthcare field to understand that antibiotics are not to be played with. It's very, very important that they're taken as directed. They're not stopped early. You don't want to save your dose for the future when you might get sick. You want to take all of the antibiotic that is prescribed to you, and you want to take it appropriately. You don't want to share it with anybody else. You know, you may go home and your husband may have the same thing that you have going on, but that doesn't mean that you get 10 days of treatment, but you cut your treatment in half at 5 days to give your husband 5 days so y'all can get rid of the infection, because what's going to happen is your body is, the antibiotic is fighting off that bacteria. Then if you don't take the antibiotic as prescribed, the bacteria is still going to be hanging around, and it's going to start getting resistant to that antibiotic that's supposed to treat that infection. This can be very, very dangerous. We see people who get urinary tract infections and then they become septic because antibiotics weren't taken as prescribed. We see people who have strep throat and they didn't take their antibiotics as prescribed, or the strep throat never got diagnosed, and then they end up having heart problems as a result of the strep. And this can be very, very dangerous, and it can be very, very deadly in these circumstances. Okay, when you're on the antibiotics, like I was saying earlier, it increases your risk of developing an antibiotic-resistant infection in the future if they're not taken as prescribed. Also, antibiotics kill the healthy bacteria that's in the gut, and that can lead to an infection known as C. diff, or Clostridium difficile. This is a very common hospital-acquired infection. It's also common in people who we see who are overly prescribed antibiotics, because what ends up happening is those antibiotics are just supposed to kill the bacteria. So what happens to the good bacteria in our body, which is known as flora, they all get wiped out. And what happens is all the bad bacteria takes over. And C. diff, even though it is an antibiotic-resistant infection, C. diff is directly related to the use of antibiotics. It's very important to take them as prescribed, because you run the risk of developing Clostridium difficile, which is make you very sick. You'll have diarrhea. You'll be throwing up. It's very contagious. It's actually a spore. The only time that it's killed is when you actually wash your hands. Hand sanitizer does not work whatsoever. So it's very, very easy in a hospital setting or a nursing home setting to pass this infection on to others. Therefore, it spreads the disease. And another thing is we're going to start getting antibiotics that are resistant to C. diff if we keep seeing C. diff all the time. Just like you have methicillin-resistant staph, and you're having to treat that infection with the big boys. You're treating it with vancomycin, gentamicin, Levaquin. You're using all these very strong, powerful antibiotics to try to rid your body of these infections. And the more antibiotics that your body has and consumes and takes in, you're adding to your resistance. So we want to try not to take antibiotics if we don't have to. We want to try to let our body fight the infection on its own, and we want to treat symptoms. There's medicine designed to treat symptoms. If your symptoms aren't getting any better after 2 or 3 days on the medicine, you need to follow up with your healthcare provider. If you're having any questions about medicines that you may be taking on a daily basis, and you're worried about them mixing and interfering and having an adverse reaction with the over-the-counter meds, you can always call the doctor's office, or you can consult your pharmacist at your local pharmacy where you get your medicines filled at. It's very, very important that people in the community do this, because people don't realize how much we are contributing to antibiotic resistance because we do not take our medicine as prescribed. You know, I see it time and time again in the hospital. People fail what we call outpatient treatment, because they go and they may have a certain infection. They may have a urinary tract infection. They go and they get the antibiotics. They only take 2 or 3 days worth, and then here they are 2 weeks later in the emergency room, and they're septic from an infection because they did not take their medicine as prescribed. And not only are they septic, they're causing their organs to shut down, or almost to the point of shutting down, and then we're sitting there having to pump them with more antibiotics just to get that body back to a good state. And then that person could end up developing C. diff later on because they've been pumped full of antibiotics to treat this infection that has overwhelmed their body. And it's very dangerous. Okay? And we've already been discussing this, but what is antibiotic resistance? It is the inability for the antibiotics to work properly. The bacteria resists the effects of an antibiotic. So you take the antibiotic, you might kill off some bacteria, but you don't kill off all bacteria. So you're leaving them hanging around, and they can end up overpowering your body and leave you very sick. And it occurs when bacteria changes in a way that reduces the effectiveness of the drugs that are designed to cure the infection. They actually continue to survive and multiply, and they cause more harm, which can lead to sepsis or further antibiotic resistance. And as I was saying earlier, it can be contributed to the overuse of antibiotics because we overly use them. We take our children to the doctor, they've got a fever, and we automatically think, well, they're supposed to leave on an antibiotic. You know, my baby's got a fever, the ear's hurting. We don't give, we want everything now and quick and want to answer in a hurry. And sometimes, you know, we need to wait things out and see how they go. And if things are turning around, then that's wonderful. We know it's a viral infection. All things evolve over time. Change is constant, and that's the same thing with bacteria. Bacteria are constantly changing, and they're trying to survive. It's kind of like, you know, it's evolution. They are changing their makeup. They're changing what would commonly kill them. And they're becoming more and more and more resistant. What's going to happen, we're going to wind up with more and more superbugs that the antibiotics that we have that have been created, they're not going to treat the infection. And then what are we going to do? What big boys are we going to bring in then when there's no more left? Okay? How can we help end antibiotic resistance? We need to educate our patients on why antibiotics are not needed. And obviously we've discussed this in this presentation. And only using them for what they're prescribed for. If you got prescribed an antibiotic for strep throat, but now you have a urinary tract infection, you don't need to take the same antibiotic that you were taking for your strep throat because it may not even treat the bacteria that is in your bladder causing the urinary tract infection. And then by you taking the wrong antibiotic, that's leading to even more resistance. And now you have taken an antibiotic that you didn't even need. So you're causing your body more harm than good. You want to take your medicine exactly as prescribed. If the doctor says take it twice a day, you take it twice a day. If he says take it 3 times a day, you take it 3 times a day. You don't cut your doses in half. You take the medicine exactly as it's ordered. And you also want to choose the correct antibiotic for the type of infection you have if it is possible. Most lay people don't know that when we do something called a culture, we collect bodily fluid or whatever source where we think the infection's coming from, and we take a sample. And once we take that sample, we send it to the lab, and the lab determines what microorganism is growing out of the sample that we obtained. If they have an active infection, it's going to isolate that infection, and whatever grows from that sample, it will determine what antibiotic is needed and what antibiotic will not even work for the so-called infection. If you take a culture of something and nothing ends up growing out of it, well, then you very well could have had just a viral infection where antibiotics wouldn't even have been needed to begin with. But it's very important if you think you have a urinary tract infection or you think you have strep throat, go ahead, go to the doctor. You know, if you think you got a urinary infection, you know, you can urinate in a cup and they can run that to the lab and they can check to see if bacteria are present. Then they send it off for the culture and sensitivity. And once that comes back, we know what antibiotic to put you on. It's very imperative that we start doing this because we are just overly prescribing antibiotics to the general population, and it's becoming dangerous. What are professionals doing to help the problem? We're starting to track infections, especially resistant infections, so we can keep a trend on what's happening, how many that are occurring, and they're targeting appropriate treatments that will be time sensitive for specific infections. Also implementing team approaches to ensure that antibiotics are only used when necessary and that the correct antibiotic is only being used when necessary. Even in a hospital setting, we may do antibiotics for pre-op patients, post-op patients. There are prophylactic antibiotics, but we need to be able to choose the best one for that patient. Because why give somebody vancomycin when you could have given them a lesser drug that's not going to cause as many problems or cause more resistance? It's very important that us as healthcare professionals start realizing this and not just giving every person that walks through the office or walks through the ER a prescription for antibiotics, because oftentimes it is not needed. Thank you for listening to me today. I've enjoyed discussing antibiotic resistance and what we can do to help end it. Thank you.